Understanding Young Adults with Colorectal Cancer, a Strategic Approach to Care. A wake-up call, addressing the overlooked needs of young adults facing colorectal cancer. Imagine being a young adult blindsided by a colorectal cancer diagnosis when you were just embarking on your career or starting a family. Now, not only do you have to grapple with a life-changing illness, but the very medical system you turn to may not be prepared for your unique set of challenges. And this is where it gets contentious. Many experts argue that the standard cancer care playbook isn't always the right fit for these younger patients. Core insights: young adults diagnosed with colorectal cancer, CRC, require care that extends far beyond the basics. It must address issues like fertility preservation and psychosocial support that older adults may not face. Relying on a more aggressive treatment path based solely on a patient's young age is not supported by scientific evidence and can sometimes do more harm than good. Why this matters now? The alarming rise in early-onset colorectal cancer cases has spurred widespread efforts to boost awareness among the public and healthcare providers alike. Efforts are especially focused on getting people to recognize the telltale warning signs, since many still assume younger adults are immune to the disease. That dangerous misconception leads to delayed diagnoses, which dramatically worsens outcomes for these patients. In a positive shift, the U.S. Preventive Services Task Force lowered the recommended starting age for CRC screening from 50 to 45 in 2021, an impactful move that's expected to save lives through earlier detection. But there's much more to this story. Beyond age, why individualized care is crucial. Gastrointestinal oncologists are now taking the lead on educating their colleagues about the critical need for personalized care strategies tailored to younger adults. Dr. Kathy Eng, a leading voice in young adult oncology, explains, younger patients may not have even started thinking about building a family or may lack financial stability. Suddenly, their world unravels. A thoughtful, multidisciplinary approach is essential to help them feel supported and to achieve the best possible outcomes. Addressing a myth: is young-onset CRC biologically unique? Here's the controversy. Is cancer in younger adults inherently more aggressive or different from that in older patients? The latest data says no. While these cases tend to be diagnosed at later stages, a fact that increases mortality risk, research shows there are few meaningful clinical or genomic differences between early onset and average onset CRC. For example, a substantial study led by Jessica Paulus looked at over 100,000 CRC patients and found stage at diagnosis, not age, was the main driver of survival. Yet, younger patients were far more likely to receive very intense treatments, even though evidence shows this offers only slight or, at times, zero additional survival benefit. This is the part most people miss. More powerful therapies can bring severe long-term side effects, like nerve damage or heart problems, and financial strain. So why this trend toward over-treatment in young adults? Some believe it's driven by the urge to do everything possible, but researchers like Dr. Andrea Serchik caution that education is needed so doctors weigh the risks and benefits more carefully. The first appointment: how to truly help young patients. For many young adults, walking into their first oncology appointment is a lonely, daunting experience. Providers are often pressed for time, but Dr. Eng argues the most valuable thing they can offer is patience, clear communication, and empathy. Taking time to review next steps, providing written summaries, and understanding the patient's support network can be just as important as any clinical intervention. And here's a question worth discussing. Should clinicians go out of their way to provide hope, even when the prognosis is grim? Dr. Eng says yes. Realistic hope, grounded in facts, can make all the difference in a patient's outlook and willingness to pursue care. Fertility and family planning. The most overlooked conversation. According to research, fewer than a third of young CRC patients are spoken to about fertility preservation when first diagnosed, despite the high likelihood that their treatment could render them infertile. A study of nearly 900 early-onset survivors found just 31% had fertility discussions with a healthcare provider. Only 12% of women and 36% of men took steps for preservation before therapy began. Over half of women experienced early menopause because of treatment. Many were left unable to have children. The urgency to start cancer therapy often overshadows these sensitive conversations. But here's the bottom line. Every young patient deserves the chance to discuss future family plans before starting treatment. Would you want your doctor to bring this up even if it feels uncomfortable? Genetic testing, an underused tool. All patients under 50 diagnosed with CRC should be offered genetic testing. Up to 20% may have inherited genetic traits that not only affect their cancer risk, but can also influence their treatment options or eligibility for certain surgeries and therapies. Yet, barriers like limited access to genetic counselors and financial concerns lead to missed opportunities. Psychosocial and financial strain, the hidden burdens. Anxiety, depression, financial toxicity, and career disruption are all too common in young adults post-diagnosis. The widely validated distress thermometer tool shows that younger CRC patients frequently experience higher levels of emotional distress, and this can directly impact whether they follow through with treatment plans. Ignoring these needs can have lasting consequences. A comprehensive care plan should include help from nurse navigators, mental health professionals, social workers, dietitians, and even support groups. For instance, even something as simple as scheduling appointments around a young patient's workday can reduce stress and improve engagement in care. How much surveillance is too much? After surgery, many clinicians have recommended more intense surveillance for young CRC survivors, fearing their risk of new tumors is higher. But emerging research challenges this assumption. A recent review found younger and older CRC patients develop new polyps at similar or even slightly lower rates, suggesting traditional surveillance intervals are appropriate for both groups. Overscreening not only causes emotional and financial stress, but may not offer any added protection. Building a new type of cancer center. Until recently, most cancer centers were ill-equipped to serve the growing population of young adults with CRC. Pioneering institutions such as Memorial Sloan Kettering and Vanderbilt have opened dedicated clinics for this group, combining the research expertise of doctors and scientists with practical, everyday support from social workers and fertility specialists. This model is gaining ground, but even centers without specialized clinics can do better by making existing social and psychological services more accessible and by routinely checking in with patients on a broader range of issues throughout their care. Your thoughts? Some may argue that more aggressive care is always better for younger adults because they have more years to save. But is this really true? Should doctors aim to do everything possible or focus more on quality of life and the patient's unique goals? Do you think emotional, financial, or fertility-related support should be considered equally vital as surgery or chemotherapy? Let us know your take in the comments.